Are you someone struggling with lower back pain and you don't quite know if your approach is really working for you? If that's the case, we can help. I'm Dr. Dukes with Body in Motion. This is my little spine friend. I'm going to explain what we're talking about today and how we can affect the lower back without even really working on it, right? So a lot of the time, the lower back gets injured due to overuse or too much work because somewhere adjacent isn't doing its job. So we think about the hips commonly or the thoracic spine, which is what we're going to focus on in this video. If everything does its part, everything stays happy. But at the end of the day, we spend so much time sitting at computers or driving that our thoracic spine tends to get super stiff and stuck. And if it doesn't do its part, the lumbar spine can't do the thing it's good at. It has to do multiple things, and that usually ends up with where it ends up hurt, right? So the lumbar spine actually really likes to flex and extend. In nature, that's what the facet joints are designed to do. It can twist, but it doesn't have as much range as the thoracic spine does and the hips. So if we think about it in that regard, that's the biggest low-hanging fruit for us to help the lower back without actually really working on it directly to say it's inflamed and we don't want to put a whole lot of pressure through the muscles. So let's think about how the thoracic spine could help it. So if we get rotation and side bending in opposite directions, that's typically how we would throw a ball. That's how we would hit a tennis ball or even a golf swing. So there's a side bend and rotation component that happens in our shoulders. And then we transfer that power down to our feet and then back up at times. So the lumbar spine is literally a hinge, and then it's stable during those movements. And what happens with a lot of people is we have these stiff lower or mid backs and we can't turn the shoulders, so it goes to the lower back to do the work. And so to keep the lower back happy, the thoracic spine does need to be addressed, right? So we think about this in a couple ways, and a great exercise that I like for patients is to go down onto their knees, and then they're going to put one hand out and slide their hips back to take the lower back away, and then you're going to rotate underneath and then come back. You'll do that a couple times, and then you're going to extend as well. So we're creating that coupled movement that the thoracic spine really likes. And while doing that, we're offloading the lumbar spine, which is the goal, right? So if this is an approach that you haven't thought of for your lower back pain and you want to learn a little bit more, schedule a discovery call or book an appointment online. We work on this every day, and it is, kind of thinking outside the box of just your pain point and looking at some of these other areas where we might be able to get a whole lot of improvement to that pain point.